I'm Holly Cohen, licensed independent broker from Preferred Medicare, back with another important update on Medicare costs for 2025. We're diving into the new premiums and deductibles just announced for Original Medicare. Plus, we'll cover what it means if you're on a Medicare Advantage plan for 2025. All right, so let's start with very basics. What you'll be paying if you're on Original Medicare only, which is the traditional government-managed version of Medicare. Part A is your hospital insurance. This covers inpatient hospital stays, skilled nursing care, and some home health services. Part B, medical. This covers things like your outpatient visits to your doctor, other outpatient care, and all preventative services. Let's talk about the Part B premium, which is the big news. The monthly amount you pay just to have Part B is going up to $185 in 2025. That's for most Americans for 2025 will be paying $185 per month for Medicare Part B. That's whether you're on Original Medicare alone, if you're on Original Medicare with a supplement, or if you're on Medicare Advantage. It's based on income, but the average American will be paying $185 per month. Take a look at the chart here, and you'll see exactly where you fall in that monthly premium for Part B. So if you're on Original Medicare, Part A is free. You've earned it by working at least 10 years and paying into Social Security and Medicare. It's the Part B premium that you do pay each month. So if you're on Original Medicare, you're paying that Part B deductible to your provider after they bill Medicare. And of course, as per usual, your Part B premiums, if you're collecting your Social Security check, it will automatically come out. If you're on Medicare, but you're not yet collecting Social Security, you will be billed quarterly from the federal government for Medicare for that $185 a month. If you want to pay monthly, you just call Medicare at 1-800-633-4227, and they will put you on a monthly direct pay plan for the $185 for 2025. If you're on Original Medicare, your coverage is handled by the federal government with federal rules and protections in place. When you're on Medicare Advantage, it is very different. So let's talk about Medicare Advantage, because this is where things start to look different for 2025. If you're on a Medicare Advantage plan, here's something many people don't realize. You're still paying that Part B premium to Medicare, of course, but your actual Medicare coverage is no longer managed by the federal government. Instead, a private insurance company, often a big publicly traded one, takes over your Medicare coverage. Here's the deal. When you join a Medicare Advantage plan, you are opting into coverage run by a private insurance company rather than the traditional government program. Your Medicare benefits are essentially privatized. This means that while you're still in the Medicare system, it's the insurance company that sets all the rules for your care. They handle approvals, they manage your doctor and hospital networks, and they decide on your coverage specifics. So what does this mean for you if you're on Medicare Advantage? More perks, more restrictions. Medicare Advantage plans often offer extra benefits like dental and vision, and some even pay money back into your check for your Part B premium. But there's a trade-off. These plans control your costs by limiting your doctor and your hospital choices to a PPO or an HMO network. That means if your favorite specialist or your hospital isn't in the network of that Medicare Advantage plan, you may not be able to see them, or you could face higher costs if you're on a PPO if you do. Unlike Original Medicare, which has uniform protections and rules set by the government since 1965, Medicare Advantage plans have their own rules. So while they're still regulated by the federal government, these plans, these insurance companies can add prior authorizations or other requirements that could make it tougher for you to access certain healthcare services. Essentially, your Medicare moves out of the hands of federal law and into the hands of a Wall Street company. So the insurance company's goals and priorities can influence your healthcare decisions, as I talk about constantly on this channel. So why is Medicare Advantage growing? Well, there are many people moving from original Medicare to Medicare Advantage plans. According to an article by Stephanie Armour at NPR, we could even see more people pushed towards Medicare Advantage. The article points out that Trump's team, along with many congressional Republicans, are big supporters of expanding Medicare Advantage. Armour says more than half of Medicare beneficiaries are already enrolled in Medicare Advantage plans, and that proportion is expected to grow, perhaps dramatically. The Heritage Foundation, a conservative think tank, even has a plan, as we've all heard in the news, that proposes making Medicare Advantage the default option for new Medicare enrollees. If that happens, we may see traditional Medicare slowly fading away as private insurers take over. This shift could benefit some people with extra perks like the free gym memberships, but it could also limit your choices. It could increase costs to taxpayers and leave people stuck in plans that they didn't necessarily choose if they want to go back to original Medicare later on because of rules with Medigap. If you've had your Part B of Medicare for more than 6 months and you're over age 65, and you want to go back to original Medicare after being on Medicare Advantage, you can actually do that right now, this time of year, October 15th through December 7th. But the trick is enrolling in a Medigap plan, such as a Plan G or a Plan N, that picks up that coinsurance, that alleviates all those hospital deductibles, and you're only on the hook for a $240 annual deductible, and you can go anywhere you want throughout the entire United States that accepts your red, white, and blue card. That's original Medicare with a Medigap plan. But to have one of those, you have to join one when you first enroll in Medicare. You have a 6-month window prior to your Part B effective date and 5 months after to enroll and be approved by a Medigap insurance company for a Plan G or a Plan N. If you are after that point in time in your life, 6 months before and 5 months after your Part B effective date, you will have to go through the Medigap insurance company's underwriting questions, either be approved or declined for that Plan G or Plan N based on pre-existing conditions. And that's why making Medicare Advantage the default could potentially harm a lot of people in the United States on Medicare and leave people stuck in plans they didn't necessarily choose if they want to go back to original Medicare later on. So as we look at 2025, it's not just about rising costs. We're also watching a transformation in what Medicare itself might look like, whether you're on original, also called traditional Medicare, or on a Medicare Advantage plan. We are here to help you make sense of it all. Remember, Medicare should work for you, and I'm here to make sure that you have the information that you need. Thank you for tuning into the channel. Make sure to like, subscribe, and reach out, comment below. You can also click on our link or go to plangfinder.com and schedule an appointment for a 2025 Medicare review, which is so incredibly important this year more than any other years in the last 10 years. This year is the most important year to do that, to have a 2025 Medicare review. There are so many changes, whether you're on original Medicare with a standalone prescription Part D plan, or if you're on a Medicare Advantage plan for 2025. You need to review your Medicare. Right now, you have until December 7th is the deadline for that review. Feel free to reach out to us. Give us a call at 855-2. Reach out. You feel free to give us a call. Reach out to us. We can help you. 855-265-6334. We can always guide you to the right decision for yourself. And we can help you learn what you need to do to make sure that you're on the best plan for 2025 at the lowest out-of-pocket costs and the lowest monthly premiums, your health needs, and your budget. That's all for now. I'm Holly Cohen with Preferred Medicare. And as always, please be well.